The Eye Care Program. 35 years of alcohol, drug abuse, and violence prevention. Serving the East Baton Rouge Parish community since 1981.
The American Cancer Society saves lives and creates more birthdays by helping people stay well, by helping people get well, by finding cures, and by fighting back against cancer.
In the 1970s, smoking was a normal part of American life, so no one ever imagined that a small-town idea would be the catalyst for national change. It all started in 1971 when Arthur Mullaney of Randolph, Massachusetts, asked his neighbors to try giving up cigarettes for just one day. In 1974, the town of Monticello, Minnesota followed suit when the local newspaper organized the state's first Don't Smoke Day to spotlight smoking's health risks and encourage people to quit. Word continued to spread west, and on November 18, 1976, the American Cancer Society's California division convinced nearly 1 million smokers to quit for the day. The following year, the society took the event nationwide, and it officially became known as the Great American Smokeout. Since then, Smokeout has become one of the Society's most successful and recognizable events, and it's still going strong today. Every year, on the third Thursday of November, smokers across the country decide to give up cigarettes for good and take one of the most important steps towards living longer, healthier lives. Through nationwide events like the Great American Smokeout, we're helping millions of Americans quit smoking so they can stay well and celebrate more birthdays.
Good morning and welcome to Eye Care Live. I am Cecile Washington, an eye care intern from Southern University, and with me today is Ms. Lydia and Dr. Gravois, and I would like to formally allow them to introduce themselves to the general public.
Well, thank you so much, Eye Care, for having me here today. My name is Lydia Kuykendal. I'm the Government Relations Director for the American Cancer Society's Cancer Action Network. We are the advocacy affiliate of the American Cancer Society. We work closely with them to ensure that elected officials at every level, state, federal, and local, make cancer a priority.
I'm Dr. Wayne Gravois, a family physician. Been practicing in the Baton Rouge area, Zachary area for over 30 years now. Recently started with the Baton Rouge General Family Medicine Residency Program, training program here in the Baton Rouge area.
Thank you. We truly appreciate you all being here with us today. So we'll get right into today's message. Ms. Lydia, what is the Great American Smokeout, and why is this day significant to our communities?
Well, thanks for the question. The Great American Smokeout was actually started by the American Cancer Society decades ago. I believe it was in the 70s. And it's viewed as one day for communities and individuals to come together to say, today I'm not going to smoke. Or today I'm going to start a plan to not smoke for 6 months, 6 days, a year, however long it is. It's supposed to be the beginning of a process, but it's a day we all take out in November every year to say, I am no longer going to allow smoking to rule my life. And it's vital because Louisiana especially has the third highest smoking rate in the nation. So we've made a lot of progress in the last 50 years in tobacco control, but we've still got a long way to go. And the Great American Smokeout is a fantastic way for us to remember how much work there is still to be done.
That's great. And so, Dr. Gravois, as a physician, Why do you think it's important for Baton Rouge General to take part in the tobacco prevention activities?
Again, being in practice as long as I have, I realize how important it is for all healthcare providers, particularly physicians, to participate in active counseling with their patients, discussing the dangers of tobacco. Studies show that physicians oftentimes can make the most major impact on patients' cessation of smoking and other tobacco products. So again, I think it's very important that physicians do this. We have been very fortunate as a member of the Louisiana Academy of Family Physicians and the American Academy of Family Physicians to have been participating in a national program for tobacco prevention called Tar Wars since the late 1980s. So some 25 years now I've been able to participate, and we have recently joined with iCare in their tobacco prevention program and have been to some 20 different programs in the Baton Rouge area, presented to at least 20 different classes last year with our residents, again talking about the dangers of tobacco.
Good. So Ms. Lydia, what are the statistics of tobacco users regarding adults and children in Baton Rouge? And is the situation getting better or is it getting worse?
Well, it's a complicated question. We don't have data specifically for Baton Rouge, but the state of Louisiana is very representative. As I said, our adult smoking rate's extremely high. Nationally, the average is 15%. We're at 24%. For youth smoking, the national average is around 10%. We're at over 12%. So those are bad numbers, but I think actually the even scarier number is the use of electronic cigarettes. For 2015, and the first time ever, the use of electronic cigarettes outpaced the use of traditional cigarettes by high school students. So 16% of high school students have tried an e-cigarette in the past year. And that's very scary for several reasons. One, many studies have shown that students who try, or youth that try electronic cigarettes, are more likely to try traditional cigarettes. And number two, electronic cigarettes are not safe. It is not water vapor. We do not have studies to know exactly what it is. The FDA has just released a rule that will start to regulate them soon, so that maybe we can find out what is in them, but we know there's formaldehyde, there's heavy metals, there are many dangerous substances in this, and so it is not something that children should look at as an acceptable alternative to a cigarette, because it's absolutely not.
And I'm glad you said that, because just listening now, that's what I was wondering. Do they think that this is an alternate, a better way?
Oh, they absolutely do. They think it's perfectly safe. They believe the commercials when they say it's water vapor. And they think, well, water's fine. Water doesn't hurt me. I'm supposed to drink a lot of water. 13 and 14-year-olds, and the marketing for them is towards that age group. It's a lot of what the tobacco companies did to market to children. It's not direct marketing, but it's having flavors like cotton candy and gummy bear and chocolate, and that's not marketed to a 40-year-old 2-pack-a-day smoker.
That's true. That's true. So, what advice, Dr. Gravois, do you give parents who would like to talk to their children about the dangers of tobacco and e-cigarettes as well, with all the new things coming out?
Sure. Well, one of the things I've learned through the years that whenever I have a discussion with anyone about any topic, in order to sway someone, get them to hopefully realize my side, is you try to meet some mutual ground. So when I speak to parents in the office, oftentimes about their smoking, I try to remind them that all the dangers that occur, the problems that occur with cigarettes, lung cancer, heart disease, stroke, various cancers in breast, lung cancer, much higher increased risk of that for smokers. And for years, when I started my practice, a lot of the people were already addicted and didn't realize the dangers. But now, everyone pretty much agrees. There's been enough studies, enough deaths actually, through the years that they don't disagree with that. So I get them to hopefully think as parents and grandparents that we lead by example, and that's one of the things that's been fairly dear to my heart as a parent, as a grandparent now. When I see these young teenagers and young adults smoking, I think how hard it is for them to have grown up most of the time, oftentimes, in a peer-oriented society where peer pressure gets them to smoke, where their parents smoke. Oftentimes I'll hear parents with their children in the room, and the parents will say, I know I smoke, but I keep telling my children not to smoke. Well, if you, as children, we look up to our parents, and when you don't walk the talk, it really affects everyone. So I try to get them to realize that not only is secondhand smoke bad for their children, increased risk of allergies, asthma, rashes, respiratory problems, infections, pulmonary infections, but also the high risk, much higher risk, that they'll eventually start smoking. And I see it all the time. It's a sad scenario. So with the TARWAS program and with the tobacco prevention program through iCare, again, we go to the schools, we talk to the parents, we send the patients home with literature on the problems that are associated with smoking, and get the children to hopefully realize that it certainly affects their short-term breathing, pocketbooks. They're expensive, as well as long-term complications. I'm buried, unfortunately, several patients through the years that have died from tobacco-related illnesses, and it's a very hard thing.
Difficult. That's right. And a lot of people saying that a lot of people have felt the pain of family members, aunts, uncles, grandparents who have.
I know that the American Cancer Society Cancer Action Network just released a report that detailed cancer deaths attributable to smoking, and we are 5th in the nation at 33%. So that's a third of all cancer deaths are tobacco related. That's an enormous amount of cancer that can be prevented, almost entirely prevented. Just like Dr. Gravois was saying, cessation is vital, but prevention is key. So, and there are really great common sense policies we can put into play there. Higher tobacco taxes, smoke-free air in restaurants, bars, and casinos. So not only is our workforce not exposed to secondhand smoke, but just like Dr. Gravois says, if any of those employees are smoking, it helps them quit. They don't bring it home to their kids on their clothes through third-hand smoke. It helps them go to work and not have to breathe in toxins. These are common sense policies that would make an enormous difference in the health of our community.
I agree. So, Ms. Lydia and Dr. Gravois, you mentioned some ways, awareness and other ways or means in which we could help prevent. So what are some additional tobacco awareness, prevention, cessation resources that are available to our community?
Sure. Well, for cessation, we have actually a unique program here in Louisiana called the Smoking Cessation Trust. It's if you started smoking before September 1st, 1988, which seems like a random date, but it's based on a lawsuit, and you're a resident of Louisiana, you get completely free, completely comprehensive cessation coverage, and that's huge. It's actually funded by the tobacco companies, and if we don't use all that money, it goes back to the tobacco companies. So we need to use all the money. Everyone needs to avail themselves of that particular resource. There is also the Quit Line. There is also cancer.org. These are great resources that can tell you specifically in your community what's going on. As far as prevention goes, cancer.org and acscan.org are great resources. I mentioned smoke-free air. We're part of the Smoke-Free East Baton Rouge Coalition. We were working with the council last year, and in 2017 we'll continue to work with the council to ensure that all residents of East Baton Rouge Parish can breathe clean air at work. We are currently working with some more, non-traditional partners in the wake of the flooding to bring cessation resources to EBR. We know that's where the city is and where the community is, and so that's how we want to help. We're working with the Capital Area Human Services District with some federal money they have coming in to do substance abuse prevention, and we're going to help them with a cessation piece, get out there and really make sure that people who were affected by flooding in a really stressful time aren't tempted to pick up the habit.
That's right. Very good. Thank you all so much. Well, thanks again for taking your time out of your schedule to discuss such an important matter. We know that everybody can receive something from this message for today. So we would also like to thank our audience. Thanks again for joining us at Eye Care Live, and we look forward to seeing you next time. Have a great day.
Hello, everybody. I want to congratulate the American Cancer Society and everyone who's taking part in this year's Great American Smokeout. Over the years, we've made great progress in reducing the number of Americans who smoke. But today, 46 million Americans are still hooked, and tobacco remains the leading cause of preventable early deaths in this country. The fact is, quitting smoking is hard. Believe me, I know. But we can make it easier, which is why we have resources available through the Department of Health and Human Services at hhs.gov to help more Americans put down cigarettes for good. We also know that the best way to prevent the health problems that come with smoking is to keep young people from starting in the first place. That's why in 2009 I was proud to sign the Family Smoking Prevention and Tobacco Control Act, which gives us new tools to keep cigarettes out of the hands of our kids, including new warning labels that make sure that anyone who buys a pack of cigarettes is aware of the risk. Today, some big tobacco companies are trying to block these labels because they don't want to be honest about the consequences of using their products. Unfortunately, this isn't surprising. We've always known that the fight to stop smoking in this country won't be easy. But it's people like all of you who make me confident that together we can help Americans everywhere live longer, happier, and healthier lives.